Dinks! It is Wednesday, and you know what that means. It's time for Hump Day Happy Hour with Dennis in the Know. This is your backstage pass for current trends, politics, and education in the dental world. As always, it is live, and it's over a delicious after work cocktail. Tonight, I've made a really bold move. Can't remember the last time I actually had a Chardonnay, but wanted to do something different. So having a Schweiger Chardonnay tonight while we talk to you. Well, I'm doing this show with my besties in the world, Dr. Chad Duplantis and Dr. Jennifer Bell. And as you all know, all of us are practicing dentists, all of us are educators, and all of us are business owners. And it is for all of us to help bring you all in the know. We have tonight a really great friend of Dennis in the Know. She's this close to becoming a dank, from what I understand. Right. We're going to talk hygiene. This is Hygiene Recognition Week, and so we thought it would be a great opportunity to talk to Kelly, who also has her Ph.D. in business management and administration. She's an incredible educator, hygienist, and just has so many great insights. And she's just a hell of a lot of fun to hang out with. So I'm really excited to have her back on. And before we bring her on, though, JB, do you have any news for us?
Just a few. We can make it pretty short. Yeah. So the first thing that Jeff already mentioned, which is absolutely relevant tonight for having Kelly on, is that it is officially Dental Hygiene Appreciation Week. So if you have not showered and loved on the hygienist in your practice, you still have 2 days. I feel like a Christmas commercial now. Don't worry, you still have 2 days left to make your appreciation known to your team and to let them know that you care and value them as a member of your office staff. And remember, in a time where we're really struggling to find good quality individuals to work and then stay in our office and actually work at a fair and reasonable wage, let's go ahead and make sure that we're showing enough appreciation to those who keep showing up every day, ready to work and enjoying you and the loyalty to your office. In addition to this week, the month of April is Oral Cancer Awareness Week, or Oral Cancer Awareness Month. So a great time for you to be thinking about social media campaigns and having open discussions with your patients about what you're doing when you ask them awkwardly to stick their tongue out, when you're checking all the soft tissues, when you're doing a palpation exam along the lower jaw and in the neck region, because you do often get kind of these strange looks. Great opportunity for an open discussion about a dentist's role in diagnosing and observing potential carious lesions and our opportunities to get early intervention and treatment. In addition, if you want to have additional discussions about HPV and the vaccinations that are available and what the correlation is between HPV and oral cancers, really awesome opportunities to have highly educated conversations with your patients. If you're a member of any of the organized dental groups, a lot of them are offering social media campaign material so that you can continue to provide that information, not just within the four walls of your office, but also in a social media realm as well. And certainly you can do your own videos and discuss what you're providing to your patients on a daily basis. I think many of my patients don't realize, and to be fair, I don't really talk about it, that we are doing those oral cancer screens. So maybe make it a priority for the month of April. Lastly, just a little note from a dink who's been around for most of this whole journey. Very early in our journey of doing these really cool interviews with really cool people, we had the opportunity to interview Representative Gosar. Now, he's a very controversial individual, and this is not meant to be political in any stretch. But the interesting piece about Dr. Gosar is that, yes, he's a member of Congress, but he's also, in his previous life, before being elected, he is and was a dentist. So he brings an interesting opportunity for us to see a day in the life of a dentist also in the House of Representatives. I was excited to see that his name was attached to the bill that finally passed through the House and then moved on and passed through the Senate that ended the emergency pandemic of COVID-19. It does not appear that the president will be vetoing this bill, so we are looking forward to finally sunsetting the emergency restrictions that come with a pandemic emergency being in place. It should open up additional doors of mask mandates, travel restrictions, etc., as the U.S. joins many other countries of moving forward with ceasing operations in an emergency platform. So always excited to see a dentist and his name associated with legislation that moved on and became law, especially in the realm of where medicine is involved. And with that, that's the news.
I personally am very excited about Oral Cancer Month next month because I think it's such an invaluable portion of our practices. And I think that we should potentially dedicate a show to that. I know that we had Dr. Ed Zuckerberg on.
And Dr. Clark, Ashley Clark.
Yeah, and Dr. Clark.
Been a huge, I mean, we've had continued conversations, and in fact, not to show too far behind the curtain of how guests come to be a part of the show, but she and I were discussing just this week about bringing on a few different pathologists and oral maxillofacial radiologists to guess that pathology.
Oh, that would be fun.
Like a game show.
Yeah. Tell him what he's won, Chad.
Okay, so real quickly, I mean, not that this show is sponsored by anybody, but what oral cancer screening devices do you all use in your practice?
My eyes.
Do you use like a Velscope or an Oral ID?
I use a Velscope, yeah.
Honestly, I think in the coming years, we're going to probably see more of a move away from that and more of a move into DNA testing and molecular testing
or RNA testing as Dr. Zuckerberg talked about.
That's right. Yeah. I think that's where the future is going to be. We've had Velscope. We've also had Trimera was another one that we used for a while, and it's a great thing to have in the office. Reimbursement, not so great for doing those things, and it needs to be mentioned, right? I mean, it doesn't stop us from doing it, but maybe it shortens the period, or, you know, it makes it difficult for a lot of people to justify and practice both from a time and an expense standpoint. I'm just being real about being a business owner as well. You know, but certainly with that said, anything semi-suspicious, we certainly will pull those out and put it under, do brush biopsies, send it off. I mean, we do need to be really diligent about oral cancer screening. But I think the future looks really bright in making that more readily accessible to most of the practitioners out there.
I don't disagree that we're going to start moving away from it, but I think it'll always have a place in our practices, you know, some sort of screening device. I mean, you know, a palpation exam as well as a, some sort of visual examination, plus an mRNA. I mean, an RNA screening as well. I think there will always be a place for it. So I think for the foreseeable future, there's definitely going to be a place. If you've never heard of metacognition,
wow,
dear girl,
that you would have never heard of this renowned leader at the forefront of reshaping dental care, helping teams and individuals achieve unprecedented professional fulfillment. Dr. Tanner has a Ph.D. in business leadership. Dr. Tanner uses her skills to train teams in a group practice setting. Through measured assessments and interaction, she helps create sustainable systems for personal and professional productivity and accountability. Her ability to motivate and metacognate the team to take ownership and metacognition of their case acceptance, builds trust and strengthens the relationship with the patients and dental team, and creates metacognition. How metacognitive was that?
That was a lot. That was a lot. I found the video.
I did too.
Send it
and
to
it's
Chad.
downloading, and it's going to take like 11 minutes. Text it to me.
Is that what your like delay and terrible?
Yeah, he's trying to
crash
do
your own
something.
system.
So
Yeah.
I love you guys so much, and I can be damp and musty for you guys. I will be your damp.
You don't want that, Kelly, though.
I don't.
It's
but
not you.
I know it's not.
You.
I mean, I feel like spicy or something should be
Yes.
in there.
Spicy.
It's so nice to be with you guys. Cheers. Let's start.
Cheers.
What are you doing?
Cheers.
Are you drinking a Chardonnay with me?
I am.
I could see by the color. That's how good your camera is.
Is it buttery or oaky?
Jennifer is not drinking a Chardonnay.
I am
She's
not.
drinking a Sauv Blanc. Is what
I
it looks like.
am.
Yeah.
Not
I can name that
California.
wine in one look.
Well, I'm glad we're all alcoholics here.
Cheers.
Awesome.
But has anyone did you show us your nails?
Mine are dental hygiene nails.
Oh yeah, but they're at least not kind of painted.
I think the last time I saw you, JB, well, the time before last when we were in Raleigh, you had just gotten them done. But
I
mean,
know.
it's
This was
dentistry.
actually that's it. You're watching the remnants, the ending of my nails.
From 3 months ago.
It was not 3 months ago, was it? She's okay.
She's
Is this
testing the
3 months
bonding
ago?
strength of her nail polish. That's what she's doing.
Yeah.
She's researching.
The
Yeah.
lady that did this should earn an extra $10. So I'm really getting my money's
I
worth
feel
out
like
of it.
that's where we should be testing our bonding agents anyway.
It's
You're
basically
welcome.
when you watch them do it and they're using monomers and, especially if they're doing
Yeah.
acrylics, and the new dip technology is absolutely like making a retainer on your finger. Like they do the powder and then they, whatever. Hold on, I'm going to clear my camera. There we go. Anyway, then I keep thinking, can you put my name in there and an arch wire that goes across the top?
Absolutely. Put some teeth up in there.
Okay, so, right. This was a video. There it is.
Okay,
There
this
it
is the one is this the one I just sent to you, Chad? This is not the one I sent to you.
I'm trying to find the exact
I
time
texted it to you.
where we got creepy, but it was actually a really fun day that we had in the Align booth. So while it's getting to that point, which we'll see in just a second, tell us about this day, Kelly. What was going on?
Oh, this particular day?
Yeah.
This meeting, this is the first time I had been to Chicago Midwinter, and it was insanely productive. I just felt like I connected on steroids. There were tons and tons of meetings back to back, just meaningful conversations. I got to hang out with you guys, obviously the award winners. And I got to say I knew you and got in some video with you all. But at this,
and we still let you hang out with us.
I know. I mean, I try, to keep up with the dings. But it was a delight to be in the background of this video and to something that you're probably going to see Chad doing in just a moment. Here we go. Making some trouble. What were we thinking? Chad was being very, very weird. He had a dum-dum lollipop.
This is why news cameras steer clear of the Duplantis family when there's a story coming out. But jeez. Well, Kelly, tell us what's going on in your world. Tell us what's going on in the educational world and the lecturing world. What's happening for you right now?
Oh my gosh, so many great things. So I am the program chair of a dental hygiene department in Williamsburg, thus Williamsburg Winery. Hello.
Nice.
And we are rounding out our last 2 weeks of clinic. And, you remember all the nerves and all of that stuff. And they're taking boards right now. And like their smartness falls out of their head. And I'm like, okay, remember you can't do that. Oh yeah, come back over here. So we are finishing all that up, getting ready to celebrate their graduation, and also working with companies to write curriculum. I'm doing some live courses. I have one on May the 16th about how to integrate 3D scanning into your hygiene appointment, a step-by-step course.
Awesome.
Yeah, I've provided bits and pieces, but I decided to go.
What's that, Chad? Wait, oh, Chad wanted to know, have you taught them how to make a proper cup of coffee yet? I just had to do that. Sorry.
Wait, who are we talking about?
Ma, the meatloaf.
The
meatloaf. JB, sorry. I don't know how they found you.
I'm not sure how they're going to keep me.
Yeah, you're
meatloaf.
And there are actually people who like to watch this.
I know.
Exactly.
We pay every one of our viewers.
You do? And you paid for your award. I doubt it.
It's an inverse relationship.
I've met you each in person and you're endearing. But so live courses about how to better connect with your patients. And, you know, Chad, you said metacognition at least 12 times, and that's not how my bio reads. But metacognition is truly just about knowing yourself and knowing your own behavior and being aware of that and what you're doing. And so what I love teaching about is about where your place is in the practice. You know, first your self-awareness, how you're connecting with others, being intentional about that, whether it be through digital scanning, whether it be through your communication, what your patient's not saying, what they are saying. Are you getting in your own way? Because I think some of the biggest lessons that each of us could take away from our day-to-day activity is that sometimes we got to know when to step up and step back.
So I'm going to take a step back here, and I'm going to ask a question that I think is burning amongst a lot of dental professionals right now. You're chairing a dental hygiene program, is that correct? Mm-hmm. Okay. I thought that's what you said. I just want to make sure I appropriately stated that. But what is the job outlook for your graduating hygienists? And you know, I think that years ago there was a lot of fear and trepidation. Is that still there, or do they feel pretty secure coming towards the end of their program?
It's always the nerves. It's always, I think, you know, being in this for 25 years now and education, their outlook is, so I think what I hear I think you're kind of asking a few things. My son just came in here and he's going to tackle me. So he threw off my thought and he was just like, yeah. And I'm like, you better not. I'm like threatening with my life.
It would fit right in with the theme of this show.
Bobo, come here. Bobo, come here. He's going to come in and say hi. But he just wanted to, you know, I don't think you guys have ever met my Bo. Say hi to everybody. This is Bo Tanner Williams. Yeah.
Hey, Bo.
How you doing,
Texas Tech.
Good.
Reckham Tech, man. I like the shirt, dude. Get your guns up or
cool.
whatever they say up there, right?
Reckham Tech. I don't know. What do they say up there?
Kelly, look in the comments. My hubby just dropped a dank for all danks.
What is it? Demonstrably amazing #1 knowledge dropper. Boom!
Wow!
Oh,
look at that. I
need a T-shirt with that. Thank you.
Yeah,
and
thanks to
Brian Bell for being the gentleman in the crowd.
Great job, Brian
really
Bell.
appreciate
You're the champion.
You know what? I just love JB more and more every day because of her. Now her husband. First, I mean, there's so many more things just keep coming.
It's a power couple now.
So back to the question.
Okay, sorry.
Fine.
Yeah.
You encouraged me to do that.
I've got to keep people on track here because obviously some people don't. Mom, meatloaf.
This is going to translate so well to podcast. Like I can't even imagine how good it's going to be.
We can get 10 serious minutes in here, I think.
Okay, we got this.
Yeah, we got
take your question, Chado.
Okay, so it's probably 3 parts. So the first is there a lot of fear and trepidation of the newly graduating hygienist? And maybe the second part is, or are they coming out expecting the world and then some? I mean, I really don't mean that to be rude or insensitive, but I'm just curious as to what they're coming out thinking they're getting into these days? Because things are different than they were pre-COVID.
Well, to answer one is that, yeah, they're crazy nervous. They feel prepared, but it's just like your first weekend as a dentist last week, Chad. I mean, you were probably really nervous and you didn't really know what you were doing, but second weekend you're killing it.
You're knocking it out of the park.
You're talking about
longer than 2 weeks,
Chad, actually.
But I mean, the trepidation's always there, but are they? Here's the interesting fact is that I teach leadership courses at Christopher Newport University in the Presidential Leadership Program, and they are all Gen Zs. And so we had this great conversation the other day of what do you do when does a Gen Z appreciate a transformational leader? Do they like a person who has vision, who can lead them, who can, and you're describing a dental office, an organization, mostly. Leaders are different in that, but you usually are going into an organization, into an office that has a vision, that has the team, our culture. And do they appreciate that? Do they embrace that? Or how do they feel about it? And they all said as a group, they said Gen Z overall has difficulty because of COVID connecting with people. And so I wonder how that translates. I'm going to answer your question in just a minute, but I'm just kind of wondering how this translates even next year as we graduate our next class and our next class and our next classes, how they will evolve and how they will be able to connect and how we get them there to that point to be able to do that. So do they expect, do they expect the world in terms of what, Chad? Do they expect the world pay?
No, I mean, okay, so it relates to a post today, and this is not a hygiene post. This was a dentist post. I don't know if any of you all saw this, but this dentist, of course, they posted anonymously, and they had all of these expectations in being an associate of a practice. And to me, I'm sitting here going, that's such a turnoff. If you come to me with this expectation that you want to make this much, but you want to give 1 day a week, 2 days a week, and you're pretty closed door to all this stuff. I mean, I've just heard a lot of horror stories. So, what are they expecting as a new graduate? Are they realistic? Are they unrealistic? Because what this person was asking today, I have no idea who it was. If it was male, female, whatever, where they graduated from, where they want to work, but what they were expecting was extremely unrealistic. And to me, I don't want that in my practice. And so, that I don't know. Does that make sense?
Yeah, I think I understand what you're saying too. And I know for a fact in our program, what we teach is, really in any part in life, you've got to provide value.
Exactly.
Where you are. It's not just about this one thing. It's not about you being the nicest person or you being this. You got to provide value and you got to know where that is. So I'm teaching them things. You'll be happy about this, not to leave a messy tray, to wipe the mirror off for the doctor because it makes you more, provides value in these small things. I know they're little things, but they all lead to big things about the caring of what you're doing, taking ownership of your operatory, what it is, what it says about you without saying anything about you. And then all the other actions follow suit in that. So again, about the metacognition, Chad, it's about that. It's about how you are showing up for your practice, for your patients, and being accountable to yourself. So, I can't say it's a perfect world by any means, but what I know is that any place in life, you got to show value. And what my point of getting back to the Gen Z conversation is that all of them raised their hand and they were 18, 19 years old in this classroom, not my dental hygienist, my other students on the other campus, non-dental hygiene. And they said, our generation expects things to be given to them. And they don't want to work. They just feel like you should say, okay, well, here's your title because you just deserve that. And I've said, okay, so are you all in agreement that that's what you truly believe? Or they just don't, they're missing the connection there. So my concern truly isn't about this class that's coming out now. It's how we're keeping our eye on the ball moving forward and teaching the empathy, teaching the connection as they all move into that. Because The hygiene students now are very similar in a lot of ways. There's not that much gap in what I'm seeing, but I can only guess where it's going to be, because if you think about the dental student or the dental hygiene student, they are, even though they're younger, they're probably more of like a millennial, right? Which is a different subset of generation. And of course, all of these are generalizations as well. But we try to say, okay, well, if you're doing this, then this, and you have to be the equal team player, and here's what that looks like.
But I think something you said that was really cool, and I'm sorry to interrupt here.
No, you're not.
This really struck a chord with me in talking about metacognition, what you said earlier about taking ownership of your own behavior and yourself and how that affects the rest of the group. I think this is probably one of the most important points that, and this goes across all industries. I mean, this is not a hygiene, a dental thing. This really transgresses the entire population. But I think that going back to basics of things like Covey's 7 Habits of Highly Effective People, right? The first 3 habits are all about dealing with yourself first. And so to deal with a group, it's I'm in charge of me. Everyone out there doesn't impact how I feel, how I react. I'm in charge of me. There are things out there that I can't have any influence on and will never have any influence on, but I'm in charge of how I react to everything else that happens to me. And all three of those first habits are about saying, okay, this is me. I understand me. I'm in charge of me. And then now how do I take an understanding of me and bring that into a relationship, into a group dynamic? And so I love that you're addressing this, and the fact that you're in this program and addressing this with students at this point in their early education, because I think that's so impactful. And I think so much of that is missing from all education, not dental education, not hygiene education. It's missing from all education about personal responsibility and ownership of your own behaviors and how it impacts the rest of the group.
And we must lead by example.
Yes.
You have to walk your walk in your practice. So if you want that, you have to be that.
And I think you're teaching them to be team players more so than anything. And I really appreciate that, because I think that's missing. It's certainly missing in professional sports, and so, they're rewarded before they even perform. But I love that you're teaching them to perform, to be a team player, and then the reward will come. And I'm sorry, JB, I totally cut you off.
No, you're fine. I'm interested, and Kelly, you may not have an answer for this, because I've thought on this quite a bit, and you talking about it tonight has sort of opened up that thought process again. Your comment about the different generations of individuals seeking employment within hygiene. Doctors are experiencing the challenges of maintaining and keeping, we'll say older hygienists, but they could be anywhere from, 5-10 years out up, and then needing to fill open positions or bring in new folks into the fold. And it's a very different dynamic in the hiring process of where they're starting salary. Like, being very transparent in my own practice, this is definitely a thing we're very much struggling with, is that we have 3 seasoned dental hygienists, and then we have an open position, and we are really struggling to find, number one, the right fit, but 2, how do you bring someone in who wants more than what your current team members are wanting to, or have been agreeable to be compensated for? And there's, as a PPO practice, there's only so much wiggle room within that compensation structure to be able to give them what they think they're due, kind of to your point. So you may not have an answer, but I know I'm not the only one sort of struggling with trying to.
That's a great question, because I've been dealing with this in employment.
And I would call you a more seasoned hygienist. So, you're having kind of an interesting place, because you're educating the younger, newer generation of those coming out, but you've been in this marketplace for a while. So I think you have a very unique perspective.
Thank you. And I think everyone has the right fit for the practice or for the organization. And I think it's whether they align. At the heart of it all, it's whether you hire them based on if they align with your culture and your core values, and whether they're able to walk that walk. And meaning that if your culture is walk the walk, or it's, we before me, if they are that person who does that, they will be able to explain to you, not just through in words, but also demonstrate to you, perhaps through a working interview for a week or something like that, to show you that, to demonstrate that, and then have them show you their value. And I don't mean that in a demeaning way, but me, I know what I'm capable of,
That's right.
I can walk in, I can tell you, I can do this every day. I bring these skill sets. Where I don't have them are here. Like I'm not licensed in local anesthesia. Don't have it. I have other bags of tricks, to be able to do that. But where can I make up for that value and know that I'm putting patient first? So I think the conversation changes once you know the core values in your practice, because then you start to attract that. And the conversation goes from how much am I making an hour to what are you bringing to our culture, to our core value system. So that's a very high level answer. And I know that you probably asking for a more definitive answer, but call me, we'll talk. But I think that everyone needs to know what they bring, and including the docs, including the entire team, because it's not fair. It's not fair to the rest of the team to do that. And also now is a good time for docs to evaluate too. It begs the question of, have I always been paying my team fairly? Should I still accept insurances that aren't reimbursing me because they're, the whole thing, the whole balance, right? So I think it's a pivotal time for you, an opportunity for you to ask these questions, because it's not just one singular thing. It's never about the money.
No.
It's never about the money in any area of life. It's always about something else. Are you truly worth it? Well, if I know that you can do this and you bring all this value to my patient and get all these referrals, do that.
Do you guys have, you guys do externship as well, I'm sure, as most hygiene programs do. And so this is something I would urge to practitioners, is that living in Conway, we have Horry Georgetown Tech, which has had a hygiene program. We have always been, for both dental assisting and for dental hygiene, we've always been a place where they would come around and they would do externships through our office. And that's where I have hired 90% of my employees, because what is that? That is a working interview. Yes. And you automatically get to see if they fit in the culture. And it goes both ways, because if the right person comes through your practice, you're like, oh my gosh, this is a good person who understands the values of this practice, I'm okay with starting her out a little higher than the average new hygienist coming out of school, because I already know she fits in. Mm-hmm. My patients already love her. My team already loves her. There's so much less risk there. So I think from both perspectives, dentists need to be more willing to participate in these programs where assistants and hygienists can rotate through their offices, because it's as much of a benefit to them as it is to the program and to the students that go through. But for the students, they also need to realize these are working interviews, because, for all the good ones that we've had, we have some that come through and I'm thinking, what are they thinking? All they had to do is come here and perform well, and they had a guaranteed job almost. Yeah. And instead, they saw it as, oh, this is just part of my education and I just need to get through this. And I don't know. I just think both sides, both sides need to look at this as, an incredible opportunity.
Agreed. And I think we're always interviewing for a job. Doesn't matter where you are, you know,
Right.
you're right. And that's what I teach them too. I'm like, people are always watching you. They're looking for how you react to things, how you handle yourself, because it's in those moments that they learn a lot about you and your character and how you're going to treat the patients, how you handle conflict. And
So Chad shouldn't throw instruments at the hygiene students coming through. Is that what you're saying?
No, they shouldn't. And then sometimes too, Jeffrey, to your point, some of those sites, you may not know this, someone there probably needs to be a faculty member, an affiliate faculty member of that college, because someone has to, if they're truly an offsite location, CODA says that person has to be a faculty who is able to grade and be calibrated with the other faculty at the other site. So there's also opportunity for different things, not just to float through, but to also be a site, an offsite evaluation, like an extension of the program. Because if you want hygiene programs to grow, then you run out of brick and mortar where you are, how else are they going to do that? So that's something to think about.
How is education for hygiene evolve? Like, are we starting to see scanning technology, CBCT? I mean, where's the evolution of technology in hygiene? Because, I mean, from best I can tell with other dental students that I've conversed with, it's still pretty behind. You know, I mean, there's a bit of a lag between what they're going to see in private practice if they're fortunate enough to associate with somebody that has that versus what they're exposed to in dental school. So I'm curious. I don't have a lot of context on that.
So in terms of CBCT, I'll speak to that one first. What's very interesting, one I hadn't thought of, is I'm like, world peace. Let's just bring in technology everywhere. Well, what happens when in a dental hygiene or even a dental school, when you bring this tech in and then the students learn it, but then who has to grade it? It's faculty who don't know how to do it. And so you have to have dentists in our program that know how to do it. And the age of the majority of dentists who are adjuncts in these programs they're not aligned with that technology.
Yeah.
Right. And so that you have to have everyone up to speed. And that's a challenge, a potential challenge for all faculty, I would say. So you could have one ambassador champion to bring all this in, but it's like, how does everyone grade it? And you can learn. There is that. In terms of 3D scanning, I have an iTero at our school that I'm building some skill assessments with and scanning our patients and showing the hygiene students what it's about. But what we have to remember is that with these programs, they are for entry-level education. And so you have about this much time.
Yeah.
And so what do? You weave it into other areas instead of like creating a whole other 2-hour course on it. You have to weave it into what you already have or teach it as a different skill. So it's there, JB, but then it's like, how does the school support the technology? Yeah.
Chad, is that you?
Is that your belly?
That's my.
Are you hungry?
That's our puppy just deciding he learned how to bark at the kennel this weekend. Sorry.
Oh,
yes, he did. Yes, he did.
Yes.
But mommy and daddy were gallivanting.
That's the first time I've heard that. And it really echoed.
Yeah, it really does echo. He decided to do it right outside my study.
Yeah.
Yeah.
But then also too, what I think is an important thing I'll say this, and I know we need to probably wrap up, but more and more as I'm in here, I've had different roles and as a dental hygienist throughout my career as an educator, doing programs, all the things, right? There's such an opportunity for companies to come in to offer their product, put it in the hands of the students, give the faculty training on that, perhaps even give them the device or the product, because what those students learn on is what they usually end up doing in private practice. And so there is such a huge opportunity there. So while the technology may cost the school X amount of money and they have to eat it or take just a portion of it for a deeper discount in the subscriptions that it costs to run those, if they eat that, it's going to, because they put it in the hands of the students at that level and it's passed that litmus test of that institution and the teaching, it's going to yield them rewards down the road.
And those suggestions go a long way when they enter the private practice world, because they may enter a practice that only has a certain piece of technology and doesn't really understand the benefits of other pieces of technology or whatnot. There's so many ways that the companies that place those products in the hands of the hygienist can benefit in the long run. I think it's very, very powerful. And the hygienist and the assistant have a lot of power within the dental office. As far as clinical technology is concerned, front office staff has a lot of power as far as clerical technology is concerned as well. Yeah. So
if they have a good boss, Chad, they have a lot of power. If they have a good boss, because when the team is happy, like if we can make their job easier, this is what a lot of people don't get. I mean, I understand we can't give them everybody everything that they want, but if you can make someone's job easier and make them feel more fulfilled, I mean, 90% of the time, the good bosses are going to do that because they're like, this is going to mean more production for my office in the long run. People who see the big picture anyway.
I agree.
And hygienists in teams, even though you're like, I'm not going to buy it, I don't know if they'll use it, they love that you believe in them for something.
Right.
I agree. Love it. And hygienists are like, I don't know why my doctor doesn't get me a scanner. I don't know. I want to use it. I watch these webinars. I do this. And it's like they're trying to beg their doctor for it. But then I understand like the follow through and that things are imperfect in a dental office. That's just, it's just how it is. But just, I don't know. You have to invest in your team in different ways, and it's not one size fits all. Ask the team member, ask the person, because a gift card isn't going to get the same reaction out of someone as time off does.
100%.
So what does the person value?
I love what you said about it not being about the money, because really the one thing I've learned in over 30 years is for most people, there's some that it is about the money. And you figure out who those people are pretty quickly. For most, it is something else. And it's really your job as an employer to figure out what that is. And it is. It's different for a lot of people.
So ask them.
Ask them. I love it.
Hygiene Appreciation Week. Ask them how you would like to how they would like to be showered with your love.
Well, I have one that has asked me directly for Bruno Mars tickets. I have promised her that is going to happen. And now it's out there on internet land. So now it has to happen.
Right? I want Bruno Mars tickets.
Yeah. Yeah. No, she's been asking me for a
long time. I saw Pitbull one time.
And she has earned it.
Hey, I just noticed that our donk chimed in, and I think it would be wonderful if maybe he would write in the comments what he values in his hygienist as an endodontist.
Does he even have a hygienist?
He is hygienist?
It's a joke.
So irrelevant.
So there are people who use hygienists to make coffee.
Maybe. I don't know. Is his wife a hygienist?
Yeah, no.
No, I know. No. I don't know. I would love to have an episode with him. That would be awesome. He's an amazing.
The donk. We're going to make that happen. We are going to make
that happen.
Yeah. We are going to make that happen. That would be a lot of fun. So
Kelly, let's talk a little bit about scanning technology.
Oh,
bringing us right back into the.
I know. See, now JB's tagged in.
I want to talk a little bit about how hygienists can use scanning technologies for education, for diagnosing or supporting diagnosis conversations with their doctors. How are you seeing the application of it?
Oh my gosh, we no longer have to use a mirror laying back on top of their head to show them what's there. It's as simple as one scan, you guys, and you get to show them, if a picture is worth 1,000 words, what is a scan worth? Because it shows you, you have all the different tools to, with the newer scanners, you have the 3D model. You have, with some of them, the near infrared technology, so you can look for interproximal caries. And you also have the intraoral photo. So one scan, 3 minutes, and you get it all. So then the patient can truly see what you're seeing. For once in your life. And then you can actually hear them say it out loud. Because before, you're trying to think, okay, what is this person even thinking? Do they value this? Do they think it's stupid? Do they want to run? Now they go, oh my gosh, is this my mouth? Is that me? And it's you. I didn't realize it was that bad. So now you understand the emotional impact of that, because it's about, we make decisions most of the time based on emotion.
That's right.
Right. And so that you get that, and you get to hear that, and you get to validate and say, okay, well, I'm glad that we caught this now, because dentistry only gets more expensive. And here's how we can help you with this. And so then you can track the changes over time with the scan as well. And you can, as I always say, give them a record of hope of how it can end up, because we all know what happens to a tooth that goes, bless you. Blessed be the chatty planters.
Sorry.
We all know what happens to a large amalgam that sits there and is taking heavy pressure where it shouldn't. It's going to fracture off. We don't need a crystal ball for that. We have science and literature that's been telling us that, and through evidence of what you see every day. So why watch it happen? It's a disservice to the patient. And the top three reasons why people lose teeth are perio, caries, and malocclusion or misalignment. Period. The end. Show them what you see. Show them what you see.
I love it. I love it. And I completely agree with you. I mean, we're all big iTero fans here. And I think that there's a lot of power in the iTero for diagnostics as well as restorative and orthodontic measures. But I love it for diagnostics. That's a great diagnostic tool.
And a lot of hygienists will say, I don't have time. You really don't have time not to use it. Because it takes these complex issues that you would otherwise have to spend 10.
That's my point. They will sometimes, thank you for saying this, and I'm sorry to interrupt you, but they will say, I just had a whole 10-minute conversation trying to convince them, where's your intraoral video? Or I didn't do it because I didn't have time. That would have taken 9 minutes out of that 10-minute conversation had you done that.
That's compared to what, right? That's compared
to the scan.
Right. Yep. And then they can take a picture of it. They can make a Christmas card from it. They can do a lot of things with that.
Exactly.
But it compresses your time. You have more time to love on your patient and to serve them through the gift of education. It's not selling, you guys. I don't need to sell anybody a crown. They need one or they don't. And they're always at choice, So.
That's so true. I mean, and when you take that out of the equation, the treatment plan presentation goes so much smoother, because you're sharing with them what they need, not what you want for them. It's what they need.
Yeah.
It's interesting, the term that you use, the treatment plan presentation, and in most general practices, right? We would bring patients back for treatment plan presentations when it was a large treatment plan. But what is the vast majority of what we do? You need 2 or 3 crowns, or you need 2 or 3 rests, or there are a couple of things going on that don't need to be big treatment plan presentations. That honestly, if the hygienist really gets the scan, gets the picture of the tooth, has the conversation, the dentist comes in, the patient's already prepared to hear it. The dentist talks about it. They're now the second person that's talking about it. There is no treatment plan presentation for most of your cases. It's like, it's pre-sold. So
it's conversation. It's
conversation, right?
That's exactly right. And it provokes more conversation.
We're doing a disservice to our patients if we don't take time to educate. If we're not treating them where they are, we are doing them a disservice. We never show up to the doctor and the doctor's like, I don't know if I feel like reading this blood panel today. They don't look like they're in a good mood. No, I mean, we're an extension of medicine. We must tell them what we see. It's only, like I said, it's only going to get more expensive, and it is what it is, and they need what they need. It's up to them. Yep, they have to have the information to make a choice. Period.
I agree.
We can't be afraid to give them the information.
That's right.
I love that. That was one of the things I learned very early in COIS too, with the sway principle and how we sit down And dentists internalize this whole thing, you know, this whole interaction. And to be fair to dentists, like, we're not painted super great in the world. You know, all the movies picture us as terrible humans. We inflict pain on awake people all the time. We have uncomfortable conversations, et cetera. So it sort of has built on itself over time. But when he talked about the sway principle, and that was with the Challenger, and they knew when the Challenger space shuttle went up that day, there was so much media pressure, political and financial pressure for that shuttle to take off. But they knew that those rubber gaskets had never been tested at that temperature, and it was likely not going to work. And they launched anyway. And I think about that so many times when I'm hesitant or I delay or think, are they really going to like me? Are they going to leave a negative Google review? All I'm interested in is money. And I just have to go back to that sway principle over and over again to say, just do the right thing, you know? And
right.
At the end of the day, only my reputation or my online Google reviews will get dinged, but nobody will actually get hurt. And if you do the right thing, then the patient is at least been serviced what they paid you to do.
That's correct. Yep. Exactly. And, you know, that theory, that leadership theory that you're talking about, I'm being nerdy, is called groupthink. It's by Janus. And he came up with it. You know, you don't want to be around a group of people who all think alike. You want to have some perspective in that. And we have to get out of that subconscious bias.
Doesn't that message need to get out in the world a little bit more right now?
Yes.
Sorry.
Listen, no,
I did not need to. I'm not being political. That message in general needs to get out to the world. Groupthink is dangerous.
Yes, it is. We need perspective on things, and not everyone has to agree. So that's a whole other thing. That's a whole other lecture I do about the psychology.
I think I would love to have a whole conversation about that.
That's the next episode.
Yeah. Next episode. Chad, we're overtime. Close us out, brother.
Well, Kelly, as always, it is a pleasure to have you here. You just do so much for dentistry, and you're so humble, and you're just an amazing person, and we love you. And you can be our demonstrably amazing #1 knowledge dropper of metacognition any day of the week. So, with that being said, we wish everybody a great week. We thank you for being here and expect to see a lot more of Dr. Kelly Tanner in the future. So thanks, everybody. Have a wonderful evening, and we'll see you next week.
Good night.